Hi everybody. I hope you guys are good. Um I just want to make this like a real quick life update, medical life update, you know. By the way, look at my nails, guys. Are they not just so pretty, right? But anyway, I'm currently doing gynecology. Um I am at a very busy hospital, right? I feel so tired almost every day, and I feel like I can't even study as productively as I should be. And we are already in week two, so in final year. And by the way, I am in final year, guys. Yes, after a long journey, a lot of you guys know, yo, it's been a long journey, but eventually we are here. Yo, with my low energy, Shem, but at least we are here, right? So I'm saying it's at that time of the year, because right now it's August. It's at that time of the year where, things feel like, yo, they're getting serious. As much as like every rotation is serious, but in the pressure of, am I gonna graduate? um am I gonna be able to do all these rest of the, what do you call, rest of the rotations? Am I gonna pass them? Am I gonna be asynchronized? So being asynchronized is when maybe you have a rotation that you couldn't pass, and when you try to remediate, so to remediate is to like write write it again in the same year before your graduation, and still you struggle to to remediate or to pass during that time, and then now you have to do the rotation again the following year. So you kind of like delayed by, I think, 3 months, and then you start your internship 3 months later. Or I'm not too sure, but you don't start it at the time that the other interns start, because you still have to finish. That's very scary, because one, when you are then applying for like a medical officer post after the 3 years, you might struggle to actually get a medical officer post, but they all come out at the same time, right? And then you are always 3 months delayed, so you might have to wait the rest of the year to actually then catch up. Like after the 3 years, you'll have to wait for the rest of the, how many years, I mean months, sorry, 9 months. You'll have to wait for 9 months so that you catch up, and then apply the following year. So it's a bit, you know. So those are the things that are currently now hate. Guti, am I gonna graduate? Am I, it's just a lot. I'm currently doing gynecology. It's very like, hands. It is hands on. I think the most tiring thing is, um it's the calls going to theater, and the patients, they just come at random times. And I wouldn't say it is as hectic as trauma. In trauma, we did so much, it felt very overwhelming. Gynecology is not like that. I think the thing that's just making it worse is the calls. You're on call um every day. I mean, every like, how can I explain this? So I'm on call every Wednesday, right? For the 5 weeks, I'm on call every Wednesday, and then you get additional 2 weekend calls, and the calls, they start from 7 a.m. until 1 a.m. the following day. So for me, that's just, it's too much, right? And you don't even get like a day off. So on the day you finish your call at 1 a.m., it's still a normal day. You still have to be there at 7:30 until 4. If that's the, if the amount of work that you have to do will have to make you leave at like 4, then it's just a normal day. You don't get like a post call day. So for me, it's a bit too much. So I'm struggling to even study. I'm struggling to, like finish my case reports. I'm struggling to prepare for the long case, for the discharge summaries. It's just so many things we have to do. And I feel like I'm on call like most of my days, and then I'm just sleeping after that, because I'm just trying to recover from the call. So it's a lot, Shem. It's a lot. But anyway, the other thing I wanted to say is that we are in so much pressure, because right now there are like no obstetrics students in the ops ward, right? So they call us, the gynae students, to come and assist in theater for the cesarean sections. So you get to go to, you do like so many, you'll be like in theater again and again and again and again. And we enjoy being in theater, but if you're not doing the rotation that you are like doing at the time, you're not really learning. Because I did ops last year and I passed it, having to do it again this year, and it's not really benefiting me. And then I have to even sacrifice some of the, maybe some of the cases that I actually want to see that are part of my rotation, then it becomes a problem. But I'm glad that they're coming back this week. I think like the workload is gonna like go down, right? So that was the other thing that was just making everything to be a bit, too much. But yeah. And then the other thing I wanted to talk about is I'm thinking of doing like a countdown with you guys until the day that I graduate, right? So I'm thinking of doing like, I know it's ambitious, like maybe 100 videos when it's like 100 days before, 100 days before I graduate. So on day 100, on day 99, day 98, like going down until the very last day, right? And even the day before the graduation. That's what I was thinking. But I know it's a bit too ambitious, but I can try and do it. And if I can't, I'll do as much as I can so that, we are in this journey together. But Sinjay, that's what I was thinking. I don't know what you guys think about that. If you guys think it's a good idea, please just let me know. And if there's like an easier way that I could actually be able to achieve this, please let me know. Because I think the most, like, not tiring, but like, the thing that just makes it too much sometimes to post things on YouTube is the fact that I have to then edit. The editing, it takes a long time, and I do the editing myself, so it becomes too much. But yeah, I'm gonna try and just take you guys along this journey. I think you guys have followed me since the very beginning. Yabonji, I just want to say thank you, thank you, thank you from all of you who have followed me, NJ, from the very beginning until now, and you're still gonna be continuing following me, because it's not the end of the journey. I know once like medical students like graduate, the channel almost becomes non-existent, but I don't want that. I want you guys to continue to follow me. I'm still gonna continue to post. The channel might evolve into something that is more matured and more, but still medical. So yeah, that's what I want to do. I want to take you guys more on a more of like a personal journey, and I might do like vlogs when I'm talking about the 100 videos. It might be vlogs, and it might be videos like these where I just give you like my feedback on how I'm feeling and the journey, the everything. So it might be like this or the vlogs, right? And I just want to update you guys as well in terms of the specialties that I might have in mind, right? Because I've gone through most of the rotations. The rotations that I left right now is just internal medicine and peds. And I did internal medicine and peds last year. So you do it both in fifth and final year, right? So at least now I have like an idea of how those rotations are, and I can comment on them in terms of, do I want to specialize in them? So that's why I'm saying it's safe for me to say it now, because it doesn't make a difference, right? So I think my first option that I'd really, really like to specialize in is emergency medicine. And right now, we are currently applying for internship, right? We are doing our verifications, and we're trying to check out in terms of like which hospital is good, which hospital teaches you things. And as like medical students, we all have different what you call students, right? So we all have different ideas as to what type of doctor you want to be, what type of intern you want to be. So that is very much influenced by which hospital you go to, right? So some people just like being out there, doing the procedures, being thrown in there and just being independent, being accountable. That's just me. I love that. I know it can be overwhelming at times, but I think that's the best way to teach doctors to be good and responsible doctors. That's just my opinion. And some people like being in an academic hospital where you feel protected, where you feel there's like a registrar, there's like consultants, there's like so many of registers and consultants, and then whatever you're not sure about, you can always ask that to be assisted and whatnot, which is also a good thing if you feel that that's the approach that you like. I mean, it's better to be safe than be in a position where you feel just overwhelmed and you feel uncomfortable and you feel like maybe you're not really well prepared. So it depends on where you want to go. So for me, I don't really want to be in an academic hospital. I've been in academic hospitals since, so that's not what I like. I also don't like this thing of doing so much admin. You do so much admin as an intern instead of doing a lot of procedures. So for me, you know, I remember I was at Bara for my trauma rotation. Like, the interns were complaining on the fact that they do so much admin and a lot of ward work, and when it comes to them being in the emergency area where like the critical cases come in for them to do resuscitations, they are not part of the resus. When it comes to them putting like IC drains, they can't even do it. At least when I was there, that's what they were complaining about. So I don't want to be that intern where I feel like there's just so many doctors that are above my level, like registrars, MOs, and consultants. All these doctors are trying to specialize, and they are all fighting for the ICD to be done by them, to a point where the intern is just an assistant. I don't want that. I want to be the one doing the ICD. I don't want to be only doing bloods. I mean, bloods, it's very like simple. IV lines are very simple. I want to be doing like the big procedures, and feel comfortable, even if I were to, maybe as an MO, if I were to go to like the Bundus, just know that I can depend on myself. And I to know that I can give my patient the best possible treatment, because I've been trained well and I've been put under pressure. Because it's not to say like the places where I want to go to, in terms of like not the place being an academic hospital, doesn't mean that it doesn't have like good doctors to teach me. When I went for my elective, I wasn't in an academic hospital. I went to, it was just a hospital near where I stay, like back at home in KZN. The doctors, they are really good. They know their procedures. They allowed me, I was in fourth year, they allowed me to do a lumbar puncture. And we were not allowed to do a lumbar puncture when we went to Bara and Simja, like this side in the academic hospital. So that's what I'm saying. And you can still see some of the interns, they get excited to do an LP. But back then, in like KZN or like the rural hospitals, they just let people do it. They like, we've done so many of them, I think also because they are short staffed. So it makes people to do more things. And I know that might sound like a bad thing to be short staffed, but I think it's to my advantage because I learn so much more, because I'm exposed to so many things. So for me, that's what I want. The hospitals that are my top pick right now is one, Tembisa. I like it in Misa because it's very hands-on. You're very independent. As much as they don't have like the resources, they don't have all the resources. But I think for me, especially because I wanna like specialize in emergency medicine / trauma. I could also do trauma, guys. I really like trauma. Thing is, the surgery part, I'll have to revise a lot of my anatomy, because since I gamed, it's a bit tricky for me to remember all the anatomy, because I did it as a short module, and I studied it to write the wait to enter into medical school in third year, right? So I didn't do it like how we do it in second year, where it's like in depth and all that. So I'll have to do that, but I don't think it's daunting anymore for me, because I've even went for forensic medicine, and I've seen like real human anatomy. So I think for me it wouldn't be like really, really hard to do trauma. So emergency medicine or trauma. So I was saying in Tembisa, there's a lot of like trauma cases and a lot of emergency cases. So going to that type of hospital is really going to prepare me for my specialty. And then the other place I'd like to go to is like Ingwelezane, big in KZN, or Ematateni, it's also big in KZN. So these are like rural, but not like rural, but like, sub-rural places where the doctors are very open-minded as to making the student, not the students, but the interns do the things, where they allow the interns to be independent, where you don't feel like you're still a student. I think that's why I also want to just go away from the vet circuit. I don't want to feel like I'm still a student and I'm just being protected by this cloud or this bubble. I want to be a doctor and actually make a difference in my patients' lives, Not saying that like how there's arrogant doctors who just want to do things and they want to be like told. That's not what I'm talking about. What I'm saying is I want to make a difference. I want to make a difference in someone's life, not just by writing things, but by doing things and learning how to do things, and not learn them only after 3 years of my years of being a doctor. So that's what I'm saying. So yeah, that's where I'm at right now. The other specialty I wouldn't mind to do, Shem, is obstetrics and gynecology. That's like my third option, but my first emergency, trauma, then obs and gynae, right? So yeah, I'm very excited. I just feel tired. I feel very burned out at this time of the year. There's just so much going on, and it's just this constant pressure of, am I graduating? Oh my God, am I graduating? But yeah, I just hope I'll get over that and then I'll be fine. And I just want to encourage everybody who's still trying to get into medical school. I saw this comment right here. So guys, please don't get discouraged. Everything is timing. A year, 2 years ago, I failed. I had to repeat the year. And I feel much more prepared now to be a doctor than I would have back then if the system had allowed me to pass, because I would always feel like I'm not a competent doctor. But right now, I feel so comfortable, and I feel that I'll make a better doctor now than I would have back then. Everything is timing. Just be patient and know that if you feel that you want to be someone or you want to do something, I feel that it's because it's part of your purpose and it's part of your journey. So don't be discouraged and derail from your journey, because the fact that you feel it and you think about it, it's because God is showing you something. So just keep on believing in yourself and don't be discouraged. Just keep on trying until you get to a point where you are where you want to be, because when I also failed that year, I felt like my world is just crashing down. But right now, I'm in final year and I feel so much more prepared to become a doctor than I would have back then. And I'm not saying this to make myself feel better. It is the honest truth. I would have always felt the imposter syndrome of the fact that I'm not a good enough doctor. I'm not even supposed to be a doctor. But right now, because of the knowledge that I have and how hard I've worked since then, I feel I'm in such a better place. So just make sure that you work hard until you get to your dreams. And like how I always say, your dreams are not big enough. If you dream something, it's possible. So yeah, just work hard. So yeah, guys, this is the end of the video. Just let me know how you guys feel about the 100 videos that I talked about. And if you guys have like video ideas that you would like for me to do, just let me know in the comment section. Thank you so much, and don't forget to subscribe and like the video. Thank you. Bye. Our greatest glory is never in falling, but in rising every time we fall. If you liked this video, please give it a thumbs up and subscribe to this channel to get more videos like these. Thank you to the new subscribers, very much appreciated.